Dear colleagues, ladies and gentlemen, my name is Nils Thoennissen. I'm a specialist in internal medicine as well as hematology and oncology. I'm the medical director of Core Blood Center, and I'm happy in the next few minutes to bring the topic a little bit closer to you about placenta, perinatal tissue, and main focus, its high potential in regenerative medicine. Just a few seconds about myself so that you know and you're aware of who's standing in front of. Like already mentioned, specialist in Hem-Onc. I performed quite a while ago a doctoral thesis in urology in a university platform in Germany with summa cum laude. I'm looking back of more than 15 years of clinical experience performing more than 1,000 hematopoietic stem cell transplantations on university platforms in patients with myeloma, leukemia, and lymphoma, and also solid tumors. I had the honor to join a lab, one of the biggest guys on this planet when it comes to leukemia, at Cedars-Sinai Medical Center for 3 years in LA as a postdoc fellow, and was leading consultant in one of the largest universities in Hamburg-Eppendorf, one of the largest in Europe. Also ran my own lab in focusing on epigenetics in cancer and inflammation. With full humility, you guys know best, much better than me as a Hem-Onc specialist when it comes to placenta, about the size, the diameter. I won't jump into deep, that's superficial. But what I'm most interested in when it comes to the function of the placenta, of course, it's supply oxygen, nutrition, and get rid of the degraded proteins. But what I'm most interested in as a Hem-Onc specialist, it's the avoidance of immunologic reaction. So that the placenta and its ingredients, its cells, are able to immunobalance the situation between the fetus and the mother to keep everything stable on immunological level. Let's have a closer look at the placenta and its contents. Obviously, stem cells. There are up to 5 subfractions of stem cells, which will come to closer the next few slides. And what I'm also interested in as a Hem-Onc specialist, T cells. Quite important for immunotherapy in the near future for solid tumors. And that's the future in stem cell research and also in clinical trials, and also for reaching clinical evidence, the secretome. The secretome of stem cells and mononuclear cells all sitting down in the placenta, meaning the proteins, talking about peptides, talking about enzymes, talking about exosomes, if anybody heard. Exosomes, pharmaceutical companies, they put in billions and billions of dollars for the patenting of the nanovesicles secreted by stem cells. So if you talk about placenta, first reflex, okay, stem cells, crystal clear, but it's far more than that. It's also including the secretome, which has been able to put down on ice and save it for the children. Tissue itself, obviously, been well known in dermatology, in wound healing aspects, also well known, the tissue itself from the placenta. What effects come in with the, by using all the highly available substances of the placenta? It's anti-inflammation, obviously, derived by stem cells and the secretome, obviously. And whenever it comes to regeneration, we face the disease in the background, the chronic devastated diseases, the chronic degenerative diseases. One of the main facts causing this kind of status is silent inflammation, chronic inflammation. So one of the main effects, anti-inflammation. Pro-immunoregulation, that's what I just mentioned, the immunobalancing between the mother and the fetus. I will tell later about some scientific background why these placenta stem cells are so highly available in immunoregulation, specifically when it comes for regenerative approaches using the autoimmune diseases, but also cancer. We talk about pro-angiogenesis. These stem cells, they're meant to be for regeneration. Their only job is get rid of the inflammation, bring in the vessels, bring in the blood, bring in life, and start to regenerate the organ, the tissue, and the cells. Neuroplasticity. I'm very interested in if we talk about cerebral palsy, autism, Alzheimer's, and mainly stroke. Neuroplasticity, once you're facing the symptoms, most probably stroke, they're necrotic lesions. And by the induction of rehabilitation in combination with regenerative approaches using specific stem cells, mainly placenta, these cells are able to build up new streets to other parts of the brain to take over the missing function of the necrotic lesion. Neuroplasticity. Pluripotency, that's the capability of stem cells to derive and to differentiate, terminally differentiate into different organs, whatever is needed. And also its anti-tumor effect. Some subfractions of T cells sitting down the placenta are highly valuable and are highly needed for specific kinds of immunotherapeutic treatments in oncology. Where are these stem cells in placenta located in its high amount? In the chorion, in the amnion, as well as in the umbilical cord, the umbilical tissue, as well as in the chorion membrane. We call them mesenchymal stem cells, and a subfraction of mesenchymal stem cells, they so-called mesenchymal stromal cells derived from the placenta. They're, for me and many other clinicians, the most highly valuable cells for regeneration. I will talk about it later. Hematopoietic stem cells, crystal clear. Everybody knows that cord blood is accepted by FDA for more than 80 diseases when it comes to leukemia and other hereditary diseases you're born with when it comes to bone marrow diseases. Trophoblast and T cells. Talking again about the pluripotency of human placenta stem cells. It's the amniotic epithelial cells, the amniotic mesenchymal stem cells, the chorion mesenchymal stem cells, the trophoblast, as well as the chronic villi mesenchymal stem cells. Here I showed you a nice graph that it's able for these pluripotent cells to derive in vitro into neural cells, as well as into glia cells. Glia cells are kind of connective tissue of the neurons in the brain. So they are prone to treat kids with cerebral palsy, autism, brain injuries, and stroke. Osteogenic differentiation. Hepatic differentiation, pancreatic, so different organs. So that means pluripotency. Whatever you want a cell to go, they can go, and to terminally differentiate into this specific organ. And again, focus, stem cells, crystal clear, yes, but there again is far more than stem cells sitting down in placenta. And pharmaceutical companies, they are focusing, just focusing now on the secretome, talking about the proteins secreted by stem cells to evoke and achieve their kind of regeneration, to build their structures in the microenvironment, closely to the stem cells, but also in far distance. Talking about chemokines, cytokines, enzymes, and so on protein level. Nucleic acid, most interest in microRNA. So they're wrapped up in so-called exosomes, endocytic nanovesicles, and they circulate everywhere. MicroRNA determines more than 50% of our phenotype, any second, any hour, 24 hours 7. And also not to forget about the metabolites, also belong to the secretome of the stem cells or placenta. We mentioned about carbohydrates, fatty acid, vitamins, and so on. If you look back about the last 15, 20 years, I've shown here nicely that there's growing numbers of clinical trials, growing number with the focus on placenta and regeneration. I already mentioned that cord blood, that's the presence. Cord blood is accepted. Everybody knows, more than 80 diseases. I don't want to repeat myself, but most interestingly, more than 1,000 clinical trials happening, performing, using placenta and its derivatives, its cells, its tissue, its secretome for regenerative medicine. And using all the potential of the pluripotency of its stem cell. This is not been published yesterday. That's from 2015. It's pretty well known in the scientific field of placenta and stem cells that they possess much better immunoregulatory properties compared to the cord-derived counterparts like cord blood or even cord tissue. So if we talk about immunomodulation, the aspect of placenta stem cells to be used in autoimmune diseases, to be used in cancer, placenta has much more potency, and here's the trial out here. It's already 8 years now. It's pretty well known that driving the placenta using the stem cells, it's much more immunobalancing than the counterparts in cord blood and tissue. Here they compared the numbers. Red bars, relatively spoken, if you seed out the cells of the placenta, 3, 4, 5 times more mesenchymal stem cells, CD106 positive compared to cord blood and here cord tissue. 3, 4, 5 times more, 80% more mesenchymal stem cells sitting down in the placenta. Right-hand side, I've shown you the immunoregulatory effectiveness of placental stem cells compared to cord tissue. They set down like human T cells, and those T cells which are responsible for inducing inflammation, inducing the Tregs, inducing autoimmune diseases. Also responsible for hiding cancer cells, hiding our immune system, obviously hiding cancer cells from our immune system. So these T cells, they will sit down with the placenta stem cells as well as the cord tissue stem cells. And look down, these in T cells were highly significantly tapered down by the placenta and its derivates, specifically the mesenchymal stem cells. If you look here at the cord blood tissue, almost none effect in its immunomodulation on the T cells, highly effect to taper down these diseases-inducing T cells by placenta-derived mesenchymal stem cells. So striking the results. This is a nice review from 2021 showing all the disease being published on the level of clinical trials, phase 1, phase 2, using placenta stem cells, neurology, cardiovascular like heart attacks, dilated myocardopathy, hepatitis, liver failure, hematologically, obviously, graft versus host disease, anemia, aplastic anemia, leukemia, and so on. On the immunological level, all the autoimmune levels, diseases, rheumatoid arthritis, ulcerative colitis, HIV, including pulmonary diseases like pulmonary fibrosis, highly significant efficacy. Endocrine level like metabolic diseases, type 1, type 2 diabetes, retinitis pigmentosa, optical nerve damage, highly efficient when using stem cells derived from the placenta, musculoskeletal disorders, dermatological diseases, and on and on. I would like you to focus on the most striking trials now in the next few minutes left, using placenta, easily derived stem cells, for this purpose, idiopathic pulmonary fibrosis. The progression could be in these highly severely affected patients, very low quality of life. The progression of the disease could be stopped after a simple infusion of placenta stem cells IV. Almost no side effects, easy to treat the side effects. We talk about irritation of the injection site and maybe some mild allergic reaction due to the DMSO, cryoprotective agent. But mainly the efficiency, quality of life was dramatically improved, and the disease could be stopped over the period of the clinical trial here over 6 months. Diabetes mellitus, diabetes type 2. Again, by the easy injection of mesenchymal stem cells derived from the placenta, this clinical trial showed that in 4 out of 10 patients, the concentration of insulin, the treatment endogenously applied, was reduced by more than 50%. C-peptide level was increased, reflecting that the body started to kick in again in the beta cells of the pancreatic region to produce insulin again. So regeneration of the beta cells in vivo in these patients. And also, nevertheless, improvement of kidney and heart function in these diabetic patients. MS. Many neurologists been afraid stimulating immune system, playing around with the immune system, because you might cause a so-called flare-up, a paradoxic reaction in MS patients, causing like not improvement, the other way around, causing like severe symptoms. Here again, showing very high safety profile in these patients after application of the placenta stem cells. no flare-up at all. It's rather the other way around. Improvement of the symptoms, improvement of quality of life, again by simple application of stem cells, IV. Traumatic diseases, ulcerative diseases, using like tissue derived from the placenta for ulcerative diseases, optic neuropathy induced by trauma. It's about 10 patients being treated, and all of them showed significant improvement after injection locally at the subtendon space of the eye of the placenta-derived stem cells. Improvement of vision, no side effects. So easy to apply. Spinal cord injury, also improvement of the nerve speed of the muscles, highly increased with increasing the effectiveness of their symptoms. Tissue engineering, that's a little bit far more in the future, but what's already happening, that with the help of tissue engineering in vitro, you can build some example aortic valves, easily being used by the placenta stem cells, for example, in congenital heart defects. What's coming in the close near future in like centers being specialized in heart diseases, for heart attacks, for chronic heart failure, they can induce kind of patch tissue, muscle tissue grown from the heart in the petri dish, and creating a small patch, transplant into the necrotic region of the affected heart, and the heart starts to regenerate in this local region. Kind of miracle, but that's what's happening in tissue engineering at the moment on Mother Earth. I'm mostly interested in cancer, where coming from treating like more than 10,000 patients in my past. CAR T-cell therapy. Immunoprize was given to two quite smart US Americans in 2018, having found that regulating the T-cells from the cancer patient, tell the T-cells in vitro where to go, where to fight the cancer. With tremendous success, worth Nobel Prize. And now the next step, because the hurdle in many cancer patients for this very expensive and approved, FDA-approved treatment is that most of the T-cells suffer from fatigue. They lost the immunocompetency because of all the treatments upfront, chemotherapy, cytotoxic regimens, and full body irradiation. So what they did here in B-cell lymphoma patients, they easily used so-called stromal cells from the placenta, donated ones, no graft versus host effect, striking, no graft versus host effect at all. And after bringing the virus, the oncolytic virus, to the CAR T cells of the placenta, very strong anti-tumor effectivity. So that was striking news on the level of cancer research. Also most striking, using the so-called stromal cells. Here they used a handful of mice, lethally irradiated with 7.7 gray. One of them, like 50% of them, receiving IM, intramuscular placenta donated human stromal cells. So these lab mice received human placenta stromal cells, and the ones who got the stem cells, they've almost fully recovered, more than 80%. Those who didn't died almost anything, like less than 10% survived. That's nice to have mouse models, but here that's the actually presented human trial using placenta stromal cells for patients suffering from leukemia and unfortunately graft failure. So they lost their grafts. The donated cells of the graft was missing. So they were losing their cells, and after 3 months it's almost lethal because they suffer opportunistic infection, missing complete their hematopoietic organ. So again, what they did after the experience with the lab mice here in Israel, they applied donated stromal cells from patients, healthy ones, injected them again intramuscular for this leukemia patients suffering all from graft failure. And you can see here nicely the red line, low amount of stromal cells, like 1 million per kilogram, 2 million per kilogram, and here the bluish one, 4 million cells per kilogram of stromal cells derived from the placenta. Any patient, all of them, all the 19 suffering from graft failure, recovered in a couple of weeks. And what you also can see nicely, bluish line, the faster and the better they recovered. No graft versus host. Let me show quickly some nice experience from patients I treated so far in the last, let's say, about 4 years now, with cord blood from cord blood center group, starting with little Sophia. She suffered from hemorrhagic stroke, fulminant stroke, overnight, suffering from unknown AV malformation, was found by her brother. She was put on coma for a couple of weeks. After she woke up, the parents were opened like, okay, right hemisphere completely gone due to the blood. She will never ever use her left side again. That was promised by the doctors in the US. She came to us. She received 50 million cells, cord blood IV. Treatment lasted over 3 hours. Pretty simple, straightforward treatment. You just have the guts to do. She came to my facility. I make it short. She was suffering from complete hemiplegia left-hand side. She was suffering from daily ongoing seizures, intermittently, aphasia, so speaking problems. And what happened after a year, almost present now, seizures reduction by 100%. She's off anti-epileptic remedy. The paralyzed left arm, she can use again. Walking distance more than 1,500 meters without any aid. Speech improved and also social behavior. That's her. She's waving. Not possible because right hemisphere gone. But it's now able. She can turn on the water tap now and switch on the light, which is tremendous for the parents. Tremendous. And for obviously. This is Dominic, famous guy in the US, used to be a very famous soccer player. Stroke, suffering from thalamic pain syndrome, suffering from seizures 2 or 3 times a week, and also severe aphasia. 50 million cells per kilogram, no immunocompromission, no nothing, very easy, straightforward treatment, 5 hours of treatment. To make it short, again, seizures reduction, 100%. Real patients, nothing from the books, real patients. He's off antibiotic remedies, pain reduction, he was on morphines. 80% pain reduction, he's off painkillers, specifically off morphines, which is tremendous for this guy. Speech improvement, 50%. He will come back in 2 months for a second shot of cord blood. That's 1 day after the treatment. We went out for a hike. It was hard for him, but no side effects, easy toleration. That's Christy from Wales. I'm gonna be finished very soon, sorry. Stroke, ischemic, with the age of 27, coming from Wales. With the age of 27, suffering from a stroke. Put on coma, 8 months. Lost case. What, she came back, she fought back, she woke up, she was put in a wheelchair and she starts to work. Again, she was told, that's your life, that's your future. Sitting down, left-hand side gone, not able to speak, complete blindness, cortical blindness, that's your future. She came to us. After a year now, she's able to lift heavy weights. I mean, for a woman, 5-10 kilograms. Wow, after complete hemiplegia. She started to see movements and colors. Not possible usually, but the optometricians told me, yes, she can. She sees movements and colors now. And she's able to walk, and she, under tears, she told us, thank you for being back in life. That's little David from Romania, suffering from autism. Caught up in himself, sitting in the corner, no talking to no one. Not able, no social skills, not able to join schools or anything like this, just for himself. That was his future. He received ABA, that's a specific therapeutic regime for autistic kids. Nothing worked. He did it for 3 years. Nothing worked, no improvement at all. He came to us, treated, 50 million cells per kilogram again, very high amount. A day after, he was able to sleep continuously for 10 hours. That's a year ago. He does it every night now. That was a big change, tremendous change for the parents. His social skills improved dramatically. He started talking and playing with the kids, with the sister. Now being able to go to the kindergarten, to specific schools, yes, but being out of the hands of mommy, joining the schools, joining other kids, joining swimming lessons, not been possible before. So I'm pretty happy to work together with Cord Blood Center, now starting not only collecting cord blood and cord tissue, which is important, but placenta is on the driver's seat. That's the future for regenerative medicine. Thank you very much for your audience. Thank you.
Thank you, thank you. Thank you, Dr. Nils.
You're welcome.
Nice presentation.